Hello everyone. Today I will be talking about the disease atrial fibrillation, a little bit about its introduction, and then we will move forward towards its causes in an easy way through a mnemonic. Okay? So first of all, what is atrial fibrillation? So atrial fibrillation is the most common sustained cardiac arrhythmia in which the atria beats repeatedly at a rate of about 300 to 600 beats per minute. Okay, so it is a type of tachyarrhythmia in which the heart rate is greater than 100, which is called as tachyarrhythmia. If the heart rate is less than 60, it is called bradyarrhythmia. So atrial fibrillation is a type of tachyarrhythmia in which the heart rate is greater than 100 and it's almost about 300 to 600 beats per minute. Okay, so what will be the findings on an ECG of atrial fibrillation? So there will be irregular rhythm, and there will be no P waves. Okay, there will be no P waves and irregularly irregular rhythm. Okay, irregular rhythm. Then we will be moving towards its causes in a very simple and very easy way through a mnemonic, that is pyrates. We will learn about the causes of atrial fibrillation through this mnemonic, pyrates. Okay, so what does pyrates actually means? In the pyrates, P means the pulmonary causes like pulmonary embolism or chronic obstructive pulmonary diseases. They can be the major cause of atrial fibrillation. Then the second I is iatrogenic. Iatrogenic means that we do not know about the cause of the disease. Okay, that is also a common cause of atrial fibrillation. Then the third one is R. R means rheumatic heart disease. That is also a cause of atrial fibrillation. Then the fourth one is A. A means atherosclerotic diseases. Atherosclerotic diseases, which includes the MI, myocardial infarction, and coronary artery diseases. Then T means thyroid. So there can be any issue in thyroid, like there can be hyperthyroidism. That is also a common cause of atrial fibrillation. Then the E means endocarditis. Endocarditis. And the last one is sick sinus syndrome. Sick sinus syndrome. So these are the seven major causes of atrial fibrillation, which you can easily remember through this mnemonic pyrates, in which the P means pulmonary embolism. The pulmonary causes like pulmonary embolism and chronic obstructive pulmonary diseases. I means iatrogenic. R means rheumatic heart diseases. A means atherosclerotic. T for thyroid, and E for endocarditis, S for sick sinus syndrome. That are the causes. And about the diagnosis, we have already talked about the diagnosis, that we will diagnose it through ECG. In ECG, we will find the irregular rhythm and no P waves, absent P waves. Then we move forward towards the treatment. So we will do the treatment again through a mnemonic, which is ABCD. What does the ABCD means? ABCD means, in ABCD, the A means anticoagulants. we will do anticoagulation, or we will give anticoagulants. The second one is beta blocker, which will decrease the heart rate. The third one is cardioversion, cardioversion, and the D means digoxin. So that was an easy way to remember the causes and the treatment of atrial fibrillation through two mnemonics. One was the pyrates and the second was the ABCD. So you can remember the causes and treatment of atrial fibrillation through these two mnemonics. And if you have any other question about atrial fibrillation, you can ask me in the comment section. And thank you so much for watching.